All right. Good afternoon, ladies and gentlemen, and welcome to our October 25th, 2018 Town Hall. I'm Chuck Ramey. I'm the Chief of Public Affairs at the VA Southern Nevada Healthcare System. So today's Town Hall, just a couple of housekeeping rules before we get started. This is a moderated Town Hall. So what that means is that we collect comment cards from people, and we do them back here. Mr. Dave Martinez can help you with that. If you have a question or something you would like addressed, we ask that you fill it out on a comment card. And that's for two reasons. One is so we have a record of it and can make sure that we address it up here and during the town hall. But the other reason is if it's an individual question or something of a personal nature that we can't really address in a public forum, we have your card and we can take it back to the specialists who can help you out and get you with them one-on-one to discuss your question, your comment, your concern, or work your issues. So that is why we ask you to fill out the cards. So I am here today to introduce our panel. From our Veterans Benefits Administration is Miss Leah Augustine. Thanks for being here. Our director, Miss Peggy Kearns. And our Chief of Staff, Dr. Ramu Kamandori. So what I'm going to do now is I'm going to turn it over to Miss Kearns and let her give you some updates on the healthcare side.
Okay, good afternoon. I really wanted to thank the North Las Vegas Fire Department for bringing Pink Pearl here today. That was exciting. If you didn't get a chance to sign your name on there, they'll be here for another hour, so you can do that while you're there. So thanks, North Las Vegas. So you all know we got a new Secretary of the VA back in, when was it, Chuck? June? Right around. Yeah, well, August. We kind of started a little earlier. And he's given us some priorities this year for us to focus on. And the first one is customer service is his first priority. Second is implementing the Mission Act, which I'm going to give you a little bit of information on. Third is to replace our aging electronic health record, because our health record started back in 1983. And it's been upgraded many times, but now we're going to get a whole new system. And our fourth priority is transforming our business systems.
Here you go.
So we're looking at modernizing some of our human resources, our contracting, and some other business processes in the meantime. I thought I would just give you a little bit of statistics that VA does every day and kind of give you a perspective on what we do here. So in the VA, there are 172 medical centers. There are 1,243 healthcare facilities and 1,062 outpatient clinics spread across the United States, but not just the United States, Puerto Rico, Guam, American Samoa, we've got places everywhere. In a typical day or in a typical year, we do over almost 5 million appointments a year across the VA. At this VA last year, we did about 900,000 appointments. So you can see spreading that out over many VAs. It's a lot of people that we see in a year. So we want to make sure that we're looking at how we can improve. And one of those improvements that they did as legislation is called the Mission Act. And the Mission Act is all about making VA healthcare something that fulfills the President's commitment to veterans for a healthy and fulfilling life. So there's many parts to the Mission Act, not just healthcare. One part of it is infrastructure. So it's the buildings that VA has all across the country. Now, we're fortunate here in North Las Vegas, we have this beautiful new facility. So the infrastructure part really doesn't pertain to Las Vegas. We have brand new clinics, we have brand new facility. But that is a big deal for the rest of the system because most of our buildings are 60 plus years old. And so how do you fix them all and how do you keep them all up to date and modern with the latest equipment? So the Mission Act gives money towards that. The second part of the Mission Act that you may not know about is the Caregiver Support Program. And that is a program that started after 9/11 for caregivers of seriously injured veterans. And the veterans have been asking, well, what about all the other eras? This was just post 9/11 that were available. This was available to. So the expansion there's going to be an expansion, and it's going to eventually include all veterans, and it'll be done in 2 phases. First, with veterans who incurred or aggravated a serious injury done in the line of duty on or before May 7th, 1975. And then the next session, which will be about 1.5 to 2 years later, will be every veteran will be available, be able to benefit from caregiver support. The biggest part of the Mission Act really, though, is about care in the community. And what it does is it combines all of the different programs we had for community care into one program. So eventually, we have a year to put this up, the entire VA. We have a year from June from this one program, and it will be administered by VA. We will not have a third party involved in making appointments and doing that. We'll be doing all that ourselves. So it's going to take a while for us to get all that in line, but they're making great progress getting us towards that. And I think you'll see less confusion is what we're hoping will be the bottom line from changing all this. In addition, the Mission Act gave us $5.2 billion to finance care in the community. So that's really exciting. And then the last part of it has to do with information sharing. And it allows VA to share health information with non-VA entities. So just makes it simpler for records to transfer back and forth between the private sector and the VA. All right. One of the biggest problems that we have here in Las Vegas is recruiting and retaining physicians and nurses. This is a tough area for finding, especially in particularly specialty doctors. So part of the Mission Act is giving us some money and some programs to offer recruitment incentives, paying for school, those kind of things through the act, and getting us more money to do that. So for us here in Las Vegas, that's really important because we rank 47th in per capita in doctors, and I think 48th in nurses, or I might have those turned around, but we rank really low. So we need opportunities to be able to attract good talent to come and take care of our veterans here. So the Mission Act gives us all of those things. Some are going to take a little bit longer for us to get to, but in general, I think all of the things that Congress did on this one is really very important and is going to help us. So I want to give you a couple little other things that are going to be happening here. This just recently, we have been approved to build a new primary care clinic building here on this campus. This place was built without any primary care. It was built hospital and specialty care. So we're going to be building a primary care building over in the northeast corner of our property. This year is design, and building should start in 2020. We've also been approved to do a women's health building. We have a women's health clinic here, but this will be a separate building. And design, yay, the ladies are liking that, yeah. The design is this year, and building would start sometime in 2020. So those are real exciting. We weren't expecting to get the women's clinic building approved. That just came up like 2 weeks ago. So keep your hats on. We're going to have some more buildings out here, which is really good that they're paying attention to us, that we're a growing facility. We're in the top 10 fastest growing facilities in the VA. So this is exciting that we're going to get to build more buildings even when we have this beautiful building here. Another thing that we're going to be doing really soon is opening 12 more med-surg beds. We don't have enough beds here. So we're going to be opening 12 beds over in Building 5, which is the orange building on the other side of this building. We have been approved to actually open 20, but right now we're going to recruit for 12 beds because we have to hire doctors and nurses for that, and then move towards opening all 20 of those beds. So that's exciting, and we've been approved also to open a psychosocial rehabilitation treatment program, which is a residential program for treatment of mental health conditions, especially PTSD, substance abuse, and general mental health. And that we hope to start implementing later in fiscal year 19, and we're in fiscal year 19 right now. So a lot of exciting things coming up for us. We're really happy that we're going to get to do those. And then I'm going to leave these two for you to talk about, Ramu. Direct scheduling. We're going to talk about direct scheduling and tele-ICU. So I'm going to let Ramu talk about that. Dr. Commodore.
Great. All right. Thank you so much for everybody for being here. I really appreciate your effort and joining us today. Beautiful day for us. First, some of the things talking about what we're going to do. We're just about to start about our robotic surgery program. So we will do first. We always do the testing and simulation. So we're about to do the simulation, and we'll first start doing robotically assisted appendectomies, and then slowly move on and do other procedures. So very positive. We have a new robot upstairs in the operating room and ready to go. So that's one good new step forward in the right direction. The other thing we've started to do is implement more telehealth care, especially for our distant rural communities. The VA in San Francisco is actually providing primary care to our veterans, some of our veterans in Pahrump, Nevada. So they will have access to that. And every quarter, they'll actually come down and provide some face to face care. So that's another positive thing. Within the hospital, Nellis has already implemented this, but we're working to get the same thing called Tele ICU. It's affiliated with the Vision 23 in Minneapolis. The tele-intensive care, essentially, you push a button on the wall, any family member can do it, any veteran can do it, any healthcare provider can do it. You push the button, it connects you directly to a tele-ICU nurse and a tele-ICU doctor, and that's usually located with some of the Minneapolis VA area. And then they will contact you and help you manage the healthcare of the veteran in the intensive care, and they can even answer questions for family members or others. So I've tested it out at Nellis, and it looks great. And we're gonna implement that over the next several months. So that's because it is hard to recruit intensive care doctors. So this is one way to help us manage this population. And Ms. Kearns already told you about adding extra beds because our hospital is always full, and we have a bunch of patients out in the community on top of that, and veterans prefer to come here. So we're working on that part of it. The one other thing to say is Nellis now has two spine surgeons, and we're working with them, getting them privileged at the VA. They'll start doing clinic at our facility, and then we'll be able to do surgery at Nellis, eventually do spine surgery here, so that veterans actually prefer having their, if they need spine surgery in the VA system, than in some of the many of the community area care or travel to another VA. We want to really minimize the care to the veterans from going to different distances, especially going up to the Bay Area, which is, as you know, very difficult, challenging distance. So we're working on that. Hopefully, we can start doing spine surgery, which is an area that we send a lot into the community. And we continue to recruit all the subspecialists we want to get. We've implemented direct scheduling in many different clinical areas, and you've seen that work. I mean, you can walk up, and you talked about audiology is one where you can go straight in. Optometry is another area we're doing direct scheduling. Oh, these are all, this has got all the rest of them. These are the ones that are there right now. I guess clinical pharmacy, mammography is the new thing that just was announced. I don't know if you've seen that. I don't know, Betty, you might have seen an announcement. So a woman veteran can contact and get access to mammography care without going through their primary care. So which is another, reduce one more step to getting the care. We have the MOVE programs, again, direct access. Oncology is a big one. Oncology drugs are super expensive out in the community. And we have veterans who are maybe not even using the VA, are getting oncology care on their own, and now they're coming in, signing up with the VA, and then they can get their oncology care through our VA system. So that's another very positive thing. Social work is available. We have tobacco cessation available through telehealth and direct scheduling too. And prosthetics will have also direct scheduling. So it will reduce some of these access things. And PM&R, physical medicine, is already doing direct scheduling. I think folks who've gone to the physical medicine clinic go directly without going to primary care. And podiatry is also implemented the same thing, along with nutrition and food services. So a lot of, I think, great positive things going on. We continue to grow. Veterans want to come to this VA. Great news for us. And thank you for using the VA, coming to the VA, and you'll see more great things happening here. So thank you.
Hello, everyone. Can you hear me? Hello, everyone. My name is Leah Augustine. I'm the chief of Voc Rehab for the VBA here. So I'm here to give you some updates with regard to the VBA. The first thing I want to do,
Testing, testing.
the first thing I want to do is say that our current acting director sends her regards with regard to not being able to be present. She's wants us everyone to know that Miss Shelia Jackson is our former director now. She was actually selected for the Decision Review Operations Center Manager in St. Petersburg, and she's already reported for that job. We have a new Veteran Service Center Manager. Her her name is Christina Tallarico, and she started on October 15th. So let's talk a little bit about our appeals reform. You know that the Modernization Act was signed into law in 2017. It goes into full effect February 2019. However, we had an opt-in, and we're calling it the BRAMP program. But we had an opt-in, and during that opt-in, we actually um, have a 84.7 days of waiting for decisions now, as it relates to getting a decision that was appealed remedy. The VA has awarded over 82 million in retroactive benefits due to this ramp that program that we have now. So another thing that I want to share with you guys is the average days for claims now, and that's the average claim, is 99.3 days, as opposed to around 82 last year this time. So we are doing better. We are aggressively um, dropping days to appeals on both the appeal side and on your new claims. So as of the end of this August 2018, over 4.42 million letters have been generated, saving over 1.18 million in posting. And that means that we're generating those letters and we're getting them straight to you through the system, which is saving money for the VA that's able to roll back into our VBA system. So thank you.
All right, great. Thanks, Leah. Appreciate you being here. All right, so as I said before, this is a moderated town hall. So, and the reason we do that is so that we can get to as many questions as possible. So if you have a question, Mr. Dave Martinez down here in the pink shirt will take your comment card. And if it's of a general nature for this forum, we'll address it here with everybody today. If not, and if it's more of a personal nature, we'll either get with you one-on-one after this town hall, or we will get the specialist who runs that area to talk to you later on. So Dr. Comanduri, I'm going to start with you. So you mentioned the direct scheduling, and I think you kind of touched upon it briefly, but I think the big thing with direct scheduling is that it frees up more primary care appointments for access in that. So primary care is one of those big things. I know we get 150 new enrollees per week. What are we doing to expand our primary care in addition to the direct scheduling?
So we're taking several steps for direct scheduling. You're right, Chuck. It opens doors for primary care because it'll save the slot that you have to go see your primary care provider to put in a consult in to go see your specialty area. Let's say mammography, whatever. It saves that part of it. So, David, Dave, can you? Yeah, you can stop. Perfect thing. Okay. So what I would say is it expands primary care availability, so we can actually provide more appointments. So that's a positive thing. As you know, primary care is really precious appointments. It's been a challenge. I just saw a veteran the other day. He goes, "Well, I've gotten 6 new primary care docs in 6 months." Unfortunately, we had a lot of changes, tremendous turnover. We're working hard to recruit and retain them. Challenge in this community, as you all know, healthcare is difficult to gain access all over the community, whether it be primary care, specialty care, very difficult in Nevada. So we're working hard to get using different kinds of things like education, debt reduction, other ways to get folks to come in and stay with the VA. And we want to create the environment that they want to stay here at the VA and continue and make a career out of it, would be primary care or specialty care. So we're working on ways we're doing a lot of packed team training so the teams can work together and provide the care for the entire panel of patients. So That's the kinds of things we're doing in primary care. We're also going to start pretty soon piloting some program to have an APRN who would be kind of a float pool person to help, so that you end up being able to manage your panel without having to take extra walk-ins. So we're going to test that out at all of our primary care sites. So we're taking a bunch of steps, but that is a challenge. I realize we do have turnover in primary care, but we continue to look for ways to maintain that.
And Dr. K, we are actually recruiting some additional primary care teams this fiscal year too. Isn't that correct?
Exactly. We're going to have 3 more teams that was approved by the director. So we're going to have those come on board. And really, if you look at the clinics there, we're working 6 days a week. We work extended hours, early morning, late in the evening, and Saturday clinics too. So we'll continue to add more clinics up here.
Great. Thanks, Dr. Commentary. Ms. Kearns, I think you hit on this question before. You talked about it when you were addressing the Mission Act, but we did have a question from the audience. And I think we're still waiting on Big VA to answer some of these questions on the exact rollout and the process. Kind of gets back to the caregiver support program. So we know the law was signed. It takes about a year for the VA to write the regulations and implement it for the Vietnam era and above. And then 2 years after that, then it'll be open to all areas. Is that correct, ma'am?
Yes. It's going to take a little time, as I said earlier, for us to get the process in place to take on new veterans and their families for caregiver support. Right now, we service quite a few people under our caregiver support program. But the good news I think about this is expanding, because Congress listened to what the veterans were asking for, and have provided us with a program that will get going, and we'll get more people to be able to participate in the program. So,
all right, outstanding, thank you. So we have some questions here that are kind of facility. Well, actually, it's there's a multi-point question here. So one is kind of a caregiver, or not caregiver, but a medical care related one. Kind of gets to telehealth. So we've had Dr. Vic, who's our chief of telehealth, come talk at these things before. Kind of the question is there are people who love telehealth, and there's people who don't like telehealth, but it's really, with Nevada's shortage of physicians, nurses and behavioral health, it's really, a lot of times, it's the only way we can get a lot of healthcare out to especially our rural communities like Laughlin and Pahrump. Can you kind of talk a little bit about kind of where we're going? I mean, I know you talked about San Francisco a little bit, but can you talk about a little bit more about what we have in place in Laughlin and kind of where we're going with both those communities?
Yeah. Our rural communities, and you'll see it increasingly in metropolitan areas. In fact, the state of Nevada made a decision to really aggressively implement telehealth, just because we're a big state and we have a couple of giant population centers, but otherwise we are a rural state. In a lot of these areas, you can't get access to care, right? Even in the big cities, it's not easy to get care. So increasingly, it's like new technology. If you told me that I can listen to music on my phone a few years ago, I'm like, I'd get sick of those ringtones. It'd be the same sound all the time, right? Never thought that I couldn't imagine 20 years ago that I could use my cell phone to listen to music, right? So this is all the new technology that we're running into and that we're used to. Same thing. It's going to take a while for folks to get adjusted to it. There are people who like the face-to-face interaction and direct connection. I get it, and we continue to offer that. But telehealth will become the mode of care in the long run. And like I always say, I told the folks in Pahrump, in the long run, we hope all of these hospitals and clinics are going to be empty. In 10, 20 years from now, all of us will get our health care right at home, where we're at, or at the coffee shop as we walk down the street. And the VA we've actually implemented, and you're going to see some of that, the VA Video Connect, where you can essentially have an appointment on your smartphone and talk to your healthcare provider. And if you want, again, some privacy issues, if you're willing to talk about your healthcare at a Starbucks, you can do that, or you can do it in your home. So you will have opportunities to use that. So we'll have point-to-point connections that way. So you'll see much more of these opportunities of advanced telehealth, teleconnection is to go. And people are used to it. People are increasingly seeing it in all their walks of life. So hopefully we'll get more folks comfortable with it.
All right, great, thanks. So Leah, a quick question for you. So you talked a little bit about the decision appeal process and the ramp process with that. We ask our VBA representative this at how many decision claims have we processed in the state of Nevada so far?
Let's see what the grand total So how many claims have we, is that the question? Mhm. So I don't have a number. I have a dollar amount, which was 82 million in retroactive benefits at an average of 84.7 days for those decision ready, those ramp claims.
All right, thanks. So this isn't really a question. This was more of an observation. This is for the VHA side for some of our facilities here. One was it was in reference for us to kind of take back, and we'll take this note back and bring it up with our team. Digital was talking about that really nothing's labeled. You don't know which line is which, or you don't know how much things cost in that. So I know there's some costs listed up there for certain items, but maybe not for others. So that's a suggestion. So thank you for providing that to us. We'll take that back and address it with our canteen service to make sure we have a little bit better signage on that one. So, and we'll go from there. Dave, did we have any other questions? All right. Sir, did you have a question?
As far as the caregiver, when it first started for 9/11, how long did it take for them to implement it? And now you're saying Vietnam 75, and then after that, well past 2020, are the funds already there? And is, what's more important, what's prioritized, the women clinic, primary clinic, caregiver, are they all the same?
Well, caregiver is a national program, so the two buildings here on campus are a priority. The caregiver support program is a national program, so they're working on that at the Washington, D.C. level to get all the regulations to add all the new people on. And you asked how long it took the first time for caregiver support. It took about 9 months for everything to get going. But we already have the rules basically for the program. Now it's just going to be getting people onto the program now that they've expanded it to a bigger group. So I don't anticipate it'll take 9 months, but we'll be told when they open the enrollment again, and we'll let everybody know when that happens.
Yeah, and it was like Ms. Kern said, they brought that on. It's Congress that funds these programs or puts these programs in place and implements it. And they brought that program on very fast. And we're really lots of lessons learned that we're still trying to pick up the pieces and move forward with. And so now we've got a standardized process across the nation. Lots of different VAs had different ways that they were implementing the program because the rules were so vague when they first started it, that they've done a lot of work in getting that right. So that piece is in place, but you do, with so many more people accessing the program, we do have to increase staffing and other things like that. So we're just waiting on those rules and regulations. So. Sir.
What is the biggest impediment for getting doctors and recruiting doctors and keeping them? Is it the government bureaucracy and all the crap they have to go through? Is it the money that they get or don't get? Is it the hours that they have to work? Is it the lack of support that they have internally? What makes up this biggest impediment? Because it's awfully hard sometimes to get an MD to talk to, and what you get is a PA, and the PA is not effective in treating the condition that you have or answering the questions you have, and it makes it really, really frustrating.
I mean, I totally agree. It's kind of all of the above. I can tell you this, and we're going to run into a tremendous, at least 20,000 physician shortage across the nation in the very near future. We're to the point. Number one, a lot of the physicians are aging out, so to speak. So they're either, it would be nice if everybody practiced till they're 90, which would be ideal, but people are just retiring and not practicing. So you're losing that population. So not just VA, but it's private sector too. Just one of my friends was in the hospital recently, and he had to wait for a week for routine testing in the community, not at the VA. So it's like part of it is that they just don't have enough staff to even just doing the basic type of testing. You think, well, you have enough technicians. They don't have enough technicians, so they have to wait till they can get the tech to do the test. So you're sitting and waiting in a hospital to get basic things done. So the challenges, we face the same thing. Certainly financial incentive is one. We lose them to the community. We're trying to offer other things. If we can work with their Number one, we can work with their loan repayment. A lot of the younger doctors have tremendous, tremendous debts. So we try to work that to bring them in. That the map incentive, and we can keep them on board. The other thing is we still have to figure out a way to make sure we provide all the incentives that are needed to attract the kind of physician that you want in this system. That is, we have three core missions, right? Number one, we take care of veterans. We take care of America's heroes, number one, right? Second, we are a teaching institution. We teach medical students. We teach residents. Most of us, I started in the VA as a medical student in 1983 at UCLA, and I never left. So we start at the VA. We do teaching. We do training, right? So that's what we do. And then we do research. Now, the challenge is that our medical school is new, really new, brand new. UNLV is like a year old now, a couple of years old. So they just took their second class. So they are still building the programs. Once you have an established school where we do academic work together, the teaching, and once we build our research, I really, really, as I ask one of our doctors here, we want to build the research infrastructure. I do some research. I want other people to do research. It keeps you young, active, your mind alert when you're doing academic research work. So we're going to do all of those, and that I think will attract the kind of person we want. If a person just says, I want to make the most money, probably they're not going to be the person that we want here. The person who wants the entire academic environment is the person who we here at the VA would be the ones that need that. But we have to offer that infrastructure. A lot of the VAs, I came from West LA. West LA, we had giant research infrastructure. I had research statisticians. I have research opportunities. We need to build those things too to attract some of these folks.
Great. Thanks, Dr. Kamanduri. And I think the other thing to mention too, as part of that mission act, is that there's an education debt reduction program that we use to try and recruit doctors, psychiatrists, and some of those other specialties. And it was only about $120,000 before, and a bill could be $300,000, $500,000 where you go to medical school, but they've upped that to $200,000. I know that we're trying to do some more with that.
Yeah, and actually the VA, just get an example, we just met this goal recently. We've struggled forever to recruit mental health professionals, and the VA has a goal of like 7 per 1,000 roughly to have mental health professionals, and we just hit that number, and part of it was by using educational debt reduction. We used it for our psychiatrists and psychologists, and we brought them on board. So that was right, good way to finally meet some of the staffings.
Those additional funds helped us attract those people. If we hadn't been given those funds, we probably wouldn't have been able to attract. We are limited by the president's salary on how much we can offer. So that makes us a little unique compared to the private sector.
Great, thanks. Well, I think that's all the questions that we had today. So we do thank you for coming out for our quarterly town hall. But before you left, I do want to give you a heads up on a couple of the things that are coming up here. So on the 10th of November, we're going to have our annual Veterans Day barbecue and car show here at the VA Southern Nevada Healthcare System. That'll be from 10 a.m. to 3 p.m. and it'll be over on the opposite side of the building, over by our education building. So that's a free barbecue and a free car show, and several of our community providers will be out there, as well as some of the VA services that you saw out here today and some others as well, and our community service providers. So it's going to be a nice event. We'll also have some entertainment out there as well. And so please come on out and spend some time with us on that. And then also with Veterans Day coming up, the Veterans Day Parade in downtown Las Vegas will be on the 11th. And there will be probably other activities that are happening in the community as well. And the VA will probably be involved in several of those. So we're going to work with our community partners to try and put those activities on the website as we learn about them. So I think I hit all the big ones there. Anything I missed that's coming up in the next?
Well, I think if you're not signed up for if you do Facebook, if you're not signed up for our Facebook page, we put all these things out on our Facebook page so that you can keep really up to date on what's going to happen. So I encourage you to do that.
And also we have another system in addition to Facebook. If you go to the lasvegas.gov or lasvegas.va.gov website, which is our homepage, under there you can enter your email address, and we have another program on there called Gov Delivery. So anytime we post anything to our website, you'll get a notification, and we periodically put out electronic newsletters that way as well. So in the benefit side, they do the same thing, but if you go to our website, you can sign up for that as well and get our stuff in real time. So, sir, you have a question?
I just want to say thank you for all the things you offer. The VA's offered more educational information. They're outstanding, and you ought to be very proud of it.
Thank you.
Outstanding. Thank you, sir. All right. Ms. Kearns, I think that wraps up our town hall. Our next town hall will be in January. So we do these quarterly, and then we do them once a year in Laughlin and Pahrump in our rural communities. But our next one will be in January, and that's going to be a partnership with our Veterans Community Engagement Board, and it'll be on a Saturday. I don't have the exact date here in front of me right now, but we'll get that put out, and that will be a transition fair. So we'll have all the different community services that help with education or benefits or transition, both employment, lots of different things, and we do specific ones throughout the year, but that one will be kind of an overarching services, and we will take care of that then. So thank you very much, and you guys have a great day.